1025. Dr Kyle Hoath is the WA President of the Doctors Union. Good afternoon.
Good afternoon, Ollie. How are you?
I'm very well, Dr Hoath. Can we just start with those first figures that I mentioned, Kyle? What kinds of things qualify a patient as Category 3 urgent?
Yeah, so urgent Category 3 are things that need to be seen within 30 minutes. So they're generally pretty serious. I mean, that's I think the Category 1 is the life-threatening, needs to be seen immediately.
Yep.
Category 2, pretty significant. Is sort of a lot of your heart attacks and things that do need kind of very immediate, but maybe not Category 1 attention. And then 3 is it is a big bunch, but that's significantly urgent. So we're not talking about little cuts and scrapes and bruises in Category 3. We're talking about people who are sick and need urgent help within 30 minutes.
And why? Because a less than third of those people are being seen within that recommendation, that 30 minutes that we said in our public EDs. Why is that the case, that less than a third are being seen?
Within that time frame. Look,
Yeah.
I mean, we had these numbers last winter as well, and I think I really think that these report cards shouldn't come as a surprise,
Right.
because this is what we've been saying. But at the very least now, as further evidence of the fact that this is why we're saying we need more beds. This is why we're saying we need a fit for capacity, a bigger health service to deal with our growing population and the growing demand for healthcare. Because it's a record low and the lowest in the country, so it's not an insignificant number.
As you said, it's the lowest in the country. We're the worst performer on this metric in the nation. So what are the other jurisdictions getting right? What are they doing better?
Look, if I'm honest, Ollie, I don't think anyone's doing it particularly well, and it's all looking pretty grim across the board.
Yep.
But yeah, certainly in this one we've fallen a little bit behind. So yeah, I couldn't tell you exactly what the other states that are doing differently, but no one's doing it well. And we're seeing that in particular with even with surgical wait times, and I think we're sort of noted a pretty significant downward trend across the country. I think the 4-hour attendance again across all of the country has dropped from 75% in 2014, 2015 to a national average of around 40 to 50% now. Like it's low.
Were there some public hospital emergency departments around the state that are really concerning you, Dr Hoath? We are statewide today.
Yeah, look, I think actually the fact that we are trying to move towards more of an integrated model across our state is probably unfair to look at individual hospitals, because we know that we don't have the capacity there. So when someone requires something specialised, there's only sometimes one place for them to go. So look, I'm not concerned about one hospital in particular. I'm concerned that just in general we're already stretched beyond what is reasonable, and this isn't news, and this is why we need a winter strategy, and this is why we need it to work, because we're coming into a period of time where we know we're going to get stretched even further.
All right, Kyle Hoath is with me this afternoon. He is the WA President of the Australian Medical Association. 1300 221 1025. You're on Drive with Oliver Peterson on 102.5 ABC Perth and right across ABC WA. Love to know your experience in recent times with emergency departments. Now, you've also found here, Kyle, that there's been a significant decline in the percentage of emergency department patients being treated within 4 hours in WA. Now, last year, we actually performed really well in this particular metric. What has changed? And is it also about access to beds and ramping?
It is, and really these are sort of different ways of measuring where that impact is felt or is causing those ramping numbers. So I think that is pretty consistent with what we see. Why? I mean, you're right. We actually performed quite well compared to the rest of the country with the 4-hour rule in 23-24, and it dropped off a fair bit in the last 12-month period. But again, we saw that, right? We saw how significant the ramping pressure was. We definitely in WA got our kind of a aging population bump, which some other states and territories had experienced maybe the 12 months prior. So look, it's pretty much exactly what we expected, which is not to say that it's in any way good, but really, I think the reason why we're saying we need more beds, we need this capacity in our system. We're seeing the numbers to back up the why.
It's not all bad news, though, is it, Kyle? Because you saw some improvements in planned surgery wait times.
Yeah, so the planned surgery wait times have dropped in terms of number of hours waited, or days waited, I should say, between elective surgery. There's I have a little asterisk on that, just that I know we have, as part of the winter strategy, some delaying of elective surgery to make sure we have capacity over winter.
Yes.
And that, we don't want to be in a position where that causes a flow-on effect for a blowout of those elective surgical waits. But yeah, look, that is a positive for us compared to the year prior.
And we still have a way to go before we return to those pre-COVID planned surgery wait lists, Kyle.
Absolutely, yeah. There's a little bit of work to done to get back to that.
I should point out that this data relates to 24/5. We've seen a huge injection as well of funding from the state government in the last 6 months alone. You estimate there at the AMA that the WA government's now spending almost $2,100 per person on public hospitals. Is that enough, Kyle? And do your members see things improving on the floors of our emergency departments?
Look, I have to say it's probably still too early to tell. There have been some improvements in some of the bare or base infrastructure, particularly when we look at some of parts of Charlie's that made the media last year. But in terms of reducing the pressure and the strain that the health sector feels like it is under, or like we're seeing the health sector is under, we're not feeling that yet. And I think probably a little bit of a nervous wait as we go into winter. So it's probably still a little too early to tell. Like I'm certainly not asking for people to click their fingers and make hospitals magically appear, and I am thankful for the investment from the government around trying to solve some of this problem, but it really highlights why that's important and why we need to make sure we go far enough, because we won't address the problem if we kind of do this half-heartedly. So yeah, probably a little too early to tell. Certainly not seeing massive improvements yet, but again, probably unfair to make that call.
Kyle Hoath, thanks for your time.
My pleasure, Ollie.
The AMA WA President, Dr Kyle Hoath, joining us live on